I am Susan Raymond with the Anna Trust, and we are thrilled to have everyone here and joining in. We have 6 people still entering the room. There was a massive crowd in the beginning when we opened it up, and so now we have a few people still entering the room. Thank you very much for joining us on this webinar, Caring with Foresight, Planning for the Wellbeing of Members of Religious Life. I am Susan Raymond. I am the Senior Advisor at the Anna Trust Foundation, and my responsibility is to set up the Anna Trust, to establish it so that we are a strong organization and we're a stable organization of deep knowledge about support for elder sisters care so that we can serve you, so that we can be available to you. Before we get started, just one point of housekeeping. At our first webinar last month, we asked for your evaluation, and you said that you would like to ask questions. So in the last 10 minutes of this webinar, we are going to open up the floor for questions. And at the bottom of your screen, if you would just raise your digital hand at that point, we will call on people as we see them. And Helen Harrington has graciously agreed to take questions at the end of the webinar. So we will call the first ones we see and try to have more interaction than we were able to do in the first webinar. So before we begin, let's center ourselves with prayer. And I'd like to introduce to you someone who many of you already know and needs no introduction, Sister Pat Murray, who is the chair of the Anna Trust, who will lead us in prayer. Sister Pat.
Thank you very much, Susan, and greetings to everybody. It's lovely to see faces that I know and also new faces. I'm very happy to serve as the chair of the Anna Trust, which is a very important initiative. So now let us turn our minds and hearts to prayer, asking God to bless us and particularly to give us wisdom as we begin this meeting. We acknowledge, Lord, that we need your wisdom and your insight, and we welcome your presence among us. Guide us as we listen to Helen and as we gather our reflections and discussions together. Help us to seek what is best for all involved, especially for our sisters who are aging. We trust in your perfect wisdom, Lord, and ask that you direct our meeting according to your will. In James chapter 1, verse 5, it says, if any of you lack wisdom, let he or she ask God, who gives graciously to all. So we ask you, Lord, for this wisdom as we reflect on this important topic for our sisters, but also for our congregations. This is our prayer, O Lord, through Christ our Lord.
Amen.
Amen.
Amen. Thank you, Sister Pat. Thank you very much. My pleasure now is to introduce Helen Harrington. The problems of providing and, importantly, affording services for elderly sisters are complex, and they're going to get even more complex as the number of elderly sisters grows and as the life expectancy of sisters, the life expectancy of us all, increases. So planning is essential. We have with us today, we're honored to have with us today, someone who can help us begin to think about how to establish that plan. Helen is Director of Stewardship Advisory Services at Cantor Fitzgerald. Cantor Fitzgerald is one of the largest investment firms in the world. And Helen, as you know, if you read the September newsletter of the Anna Trust, and I cannot imagine that anyone didn't read the September newsletter of the Anna Trust, which featured Helen. She has deep knowledge of religious life. She has family members who are consecrated religious. And as a girl, she spent many hours visiting religious congregations, visiting convents, and learning about their ministries and the leadership of sisters globally in their ministries. So, Helen, we are thrilled to have you. You know planning back and forth, and you know religious life, and you know consecrated sisters. And so you are the perfect person to lead us. So I will step back, and the floor is yours.
Okay. Thank you so much. Hello to everybody in the various locations around the world. It's wonderful to be with you all here today, and I hope to be able to share some of my experience and knowledge with you to assist you in your various roles of leadership of your congregations around the world. So let me start sharing. So just to give you an overview of what we are going to cover in our webinar here today, I'll give you a very brief overview of the company that I work for. I know Susan just covered part of it. Give you an outline of this area of planning, caring for foresight, why you need to plan. I will try to outline in a very broad way to set the context to discuss the reality of religious life around the world as it stands today. The other thing that I will try to cover today is what I've called the life cycle of elder care. But ultimately, this is looking at the different realities of elder care around the world and how that kind of has impacted religious congregations. I will give you some key considerations for your future planning, for the future planning of your membership. And the kind of main focus of the webinar today is that I'm going to describe to you 4 different case studies of congregations that I have worked with, all related to elder care and different scenarios in different locations around the world. And hopefully these case studies will give you some understanding of the experiences of others and to help you plan into the future. And then finally, some recommendations and a summary of the presentation. So really, as I've said, the objective of today is to try and help you, whether you are in leadership or not, but to kind of equip you with some of the strategic tools that you need for planning for the well-being of your members. We'll explore, as I've said, the global realities and some of the emerging and ongoing needs in religious life, and then sharing these practical case studies to help foster dialogue. Because really, as I say here in my quote on this slide, caring for your members begins not just and only with compassion, but with clear foresight and planning. It's really about assisting either those in leadership or those who are responsible for members to help them to make sure that you can support your members now, but also into the future. A brief overview of who we are and who the company I work for. We are called Cantor Fitzgerald, but I also work for a division of that called L&P. And really, we work, yes, we're a global investment firm, as Susan outlined, but I am based in Ireland, and the kind of division I work for, we specialize in providing services to religious congregations, to charities, to not-for-profit organizations. We are, as I said, based in Ireland, but I also work internationally as well. I've just come back from a visit to Kenya, Tanzania, and Ghana for a group I work with. And really, we try to offer advice and solutions to cover all aspects of kind of the activities of congregations and to assist them in planning for the future. I won't give you too much background about myself. Hopefully, people have read the September newsletter, as Susan outlined, but I have now been working with religious congregations for almost 20 years. 10 years of that has been in Ireland, but I also spent 10 years working in Rome as well with international congregations. So if we come to the first question that I posed to you, so why plan for the future? Well, very much it's about ensuring that you can plan and anticipate for the future needs of your sisters. It's about ensuring that if you plan with care, you can reduce the potential issues that you may face in the future. Very much we're all aware of sisters' lifelong service to the mission that they give, and planning for their future care really honors this service that they have given to the mission to make sure that they can continue to live the mission, but in a different way and through the care of those sisters. An essential part of this is ensuring that whatever support structures you put in place for the care of your sisters, that these are sustainable for the future, but also based on local realities. When I come to talk about some of the case studies later on in this presentation, I will give you some answers in terms, or some examples, sorry, of sometimes where congregations try to build care which maybe isn't appropriate to the local reality. It's more appropriate to what's done in other countries. Or other examples where maybe the structures that have been put in place are not sustainable for a longer term, but only for a short term. So I'll give you some examples of those. The other reason, again, why I say why you should plan for the future is about ensuring I call it the appropriate stewardship of your resources. Now, I'm always very conscious of using this word stewardship in English because it doesn't translate very well to other languages. Sometimes in other languages, it's called the administration of your resources, but it's about more than that. It's about ensuring that you can take care of the resources that you have at your disposal for mission, both now and into the future. And that is not only taking care of your membership, but also ensuring that you are responsible about the administration of your finances, that you are responsible about the administration of the property resources that you have available to you, because all of these resources are at the service of your mission, and you need to ensure that that mission can continue into the future, and you need resources for that. I put at the bottom of this slide a quote that I very much enjoy from it's an article from the Global Sisters Report, which said at the very beginning, "When it comes to aging gracefully, nuns could teach the rest of us a thing or two." Not being someone who is in religious life, but very much working with those who are in religious life, I think this statement is very true. One of the factors and one of the things that I focus on in my work in planning for the future is doing projections of membership. And the reality is that in general, women in religious life live a lot longer than those who are not in religious life. There is increased involvement in community, ongoing involvement in ministry. There are many different factors relating to this, but I think that the general population could learn a lot from those who are in religious life. So just in terms of if I try and set the context a little bit for, the nature and the global reality of religious life, one of the things that I'll show you today in this webinar is the significant decrease that there has been in the number of religious sisters worldwide. I know I work internationally and that there are differences from a geographical perspective around the world, but in general, the number of religious sisters is declining around the world. The reality for most congregations, I would say, is that there, in general, is an aging population of religious sisters in many congregations. And again, there's different life cycles related to that, but for the most part, there are larger numbers of religious sisters that need to be taken care of. Of course, there are regional differences, even in relation to new vocations that are emerging and still present, and the needs of sisters. But in general, there are kind of similarities for religious sisters around the world, and I'll cover some of those today. There are, of course, continuing needs for congregations when they are trying to consider the care of their members. Healthcare and elder care is a primary kind of need in religious congregations, ensuring that healthcare is appropriate, ensuring that elder care is appropriate. But that kind of has to always be present in relation to other needs that exist, like community support and spiritual well-being, the ongoing needs in terms of future vocations and formation, the financial sustainability of congregations, the needs of sisters require financial resources, and how can you ensure in leadership that those resources continue to meet the needs of your members and meet the needs of your mission? And then very much connected to membership, the changes in your membership is continuing involvement in ministry. Again, the reality of the number of members that you normally have, the age profile of those members, impacts your involvement in ministry. Many of the groups that I work with, particularly in Europe and in North America, they talk about this phrase now of completion. They're looking to divest their involvement in ministry, hand over to more lay groups to continue the mission. But in other areas of the world, for example, some of the countries I was just in Africa, there's still very much direct day-to-day involvement in those ministries. And most of it is connected to the number of sisters who are available for these ministries and how the mission can be lived. So this chart here shows us the number of religious sisters worldwide from 1970 to the latest year we have data for, which was 2023, so 2 years ago. So back in 1970, there were more than 1 million religious sisters around the world. And, you know, in general, I think there was almost a peak in the 1960s and 1970s in terms of those entering religious life. And you can see that over the last 53 years, there has been a decrease in the number of sisters. And the year that we have the latest figures for, in 2023, there were just under 590,000 religious sisters around the world. So that's a 41% decrease over the last 53 years. The reality, I would say, from my experience in working with female congregations around the world is that there may be a point at which the number of religious sisters plateaus, that it neither significantly increases or decreases. But the reality, I think, over the next 20 years at least, is that there will continue to be a decline in the number of sisters, but at some point it may level out, but a decline over the next 20 years is likely for the future. What I thought was interesting was looking at the number of religious sisters in comparison to male religious around the world. So if we look back to the figures from 1970, in fact, there were almost twice as many religious sisters than there were male religious. And this includes diocesan priests, priests in religious congregations, and religious brothers. So this ratio of almost 2 religious sisters for every male religious around the world as well. But you can see actually there has been less of a change in terms of the male religious around the world over the last 50 years. And in fact, there's only been a 9% decrease over the last 53 years. And the ratio now, we call it that, between the number of religious sisters versus male religious as a totality has changed significantly over the last 50 years. And now, yes, there are still more religious sisters, but it has changed in terms of comparing it to those male religious. What I've tried to do in the next couple of slides is just to give a very, again, overview in terms of trying to set this context and talk about the reality of religious life across the world. I'm very conscious, even as I talk about geographical regions, that of course the reality is different for particular countries, and even within countries, within even particular regions of countries, that the reality may be different. But this is just from a very high level perspective because it really impacts the planning in terms of care of sisters in each of these kind of geographical regions as well. From the perspective of Africa, just as a region, statistically speaking, if we look at Catholic populations, this is an area of very strong growth around the world in the Catholic population. Even in 2023 alone, there was an increase of 3% of the Catholic population in Africa. There has been and continues to be an increase in vocations in Africa, again, depending on the country, but for priests and seminarians, that's true, but also for religious sisters. And even in the work that I do, so over the last 20 years, for many international congregations, there is a focus on vocations coming from Africa. They are not coming in the same kind of increase that I think was expected 20 years ago, but it is still a source of vocations for many international congregations. The other thing that's true is I think that really Africa is kind of emerging as a global center for Catholic vitality. I think a very good example of this is 2 weeks ago, I was at a local church in Tanzania, and this was a rural area, and the Catholic Church was so busy and full of local people of every age, from small babies to older people. And if I compare that to my local parish here in Ireland, where the majority of the population at Mass on a Sunday is very much older people, less families, and kind of less involvement, I think really you can see the vitality of the Catholic Church very present in Africa. Within Asia, again, this is from a very overall perspective. There's been a small growth, a modest growth in the Catholic population. And I would say a slight increase in religious sisters, especially in Southeast Asia. Again, many of the congregations that I have worked with over the last 20 years still have vocations in Southeast Asia. India is a particular source of vocations. The same, the Philippines, Indonesia, Papua New Guinea are countries that come to mind. And even from an Asian perspective, both India and the Philippines are really major centers of Catholic life. Within Europe, again, in general, there has really been stagnation or decline in the Catholic population, a very sharp decline in terms of the number of religious sisters, but also those male religious, so priests, and really very much aging congregations and increasing secularization within Europe. Within North America, a very significant decline in terms of the number of religious sisters. So when we saw in that first slide that around the world, the decrease has been, it was 42% around the world over the last 50 years. That decrease in North America has actually been 78% over the last 50 years in terms of the number of religious sisters. So the reality of religious life in North America is very much aging religious communities and fewer young entrants. So very much an aging profile in terms of female religious life in North America. In Central America, again, moderate growth. There is a high Catholic identity in certain countries, and there are some vocations within Central America, but they are in decline, even though it very much depends on the cultural context. From the perspective of South America, really Brazil alone has 182 million Catholics, and really South America has the largest share of global Catholics. But despite this very strong Catholic identity, there has been a decline in vocations within South America. And really, there's kind of an impact of different religious dynamics which impact the area overall. In Oceania, very much this is also influenced, I would say, by migrants that come from Southeast Asia. And there is a small but growing Catholic population, but overall a decline in religious sisters and priests. But very much I would say that because of the decline and the aging population in Oceania, particularly in New Zealand and Australia, there has kind of been a lot of work done, particularly over the last 20 years, in terms of lay involvement and pastoral innovation. So really involving lay people in a new way in how congregations work. And that kind of has influenced other areas in the world as well. From the perspective of elder care, one of the things that I said at the beginning of the webinar was there's almost a life cycle of elder care. And I think that's almost reflected in the kind of the needs for elder care in congregations around the world in different places. So very much Europe at the moment, as I've already said, there is a reducing number of religious sisters, and there's no longer the same demand for elder care that there has been in the past. So if we're considering a life cycle, Europe is really at the end of this life cycle. In Europe, we are very lucky in a lot of cases that care is either provided by a government or through private healthcare providers. But a lot of congregations, in my experience now, are divesting, so kind of moving away from providing a kind of traditional nursing home or elder care facility and finding other alternatives for their reducing number of sisters who require care. Often that's moving into either a public facility or a private facility, but there is much lower requirement for elder care now, so congregations are moving away from providing that care themselves. It's also very similar within the United States and North America in general. I can include Canada in this. So very much in a similar way to Europe, there is this reducing demand for elder care. Often care, particularly in the United States, has been provided by congregations in kind of private nursing care facilities, often that congregations will pay for themselves, although sometimes there are some limited government supports available. Again, in my experience, one of the biggest factors in the provision of elder care in the United States is just in general the cost of the provision of care, the expenditure that's required for this. It is one of the most expensive places in the world for medical care, and that's often reflected in the needs of religious sisters as well. So if there are large communities that require care facilities, this ends up being a significant financial investment for congregations, and that impacts other decisions that they have to make. From the perspective, I've called it Latin America in general, and really I would say that the demand for elder care really varies based on local realities. There is, I would say, less kind of focus on having kind of private nursing home facilities, and very much I would say that care provision is shaped by communal tradition, so saying that often sisters remain within communities for as long as possible. But there are also other collaborative initiatives that are often in place. but sometimes it is impacted on the availability of local resources, whether that is government or private resources, and also the infrastructures that are in place in certain countries. So often it's about the local reality, but also local culture as to how sisters are cared for. Within Asia, and again, this is a very general perspective because obviously it's a large geographical region with very diverse realities, but elder care within Asia, really, it's diverse and evolving. There are very strong cultural traditions which impact the provision of care. Many of the groups, so some of the groups that I've worked with, particularly if I look at Japan or even if I look at Korea, there are often larger elder care communities where sisters are cared for within community, but often that's shaped by the culture and what is done by elderly, even for normal families, rather than even those in religious life. There are significant demographic shifts as well. So countries, again, like Japan and Korea, are very different to countries that are growing, for example, in Southeast Asia. If I think of the Philippines, Papua New Guinea, Indonesia. So there's often a lot more elderly sisters in places like Japan and Korea and younger sisters in Southeast Asia. So again, how the care is provided really changes based on that reality. And as I've said here, the majority of care really is provided for in convent-based communities. Sometimes they are cared for by sisters, but other times by lay staff, and it depends on the changing demographic realities. From the perspective of Africa, and again, if we think about the life cycle, really Africa, I would say, is that care is becoming, as I've said here, increasingly recognized as a vital priority for the care of members. It is one of those places where often in the past there were maybe older, sometimes European, sometimes American, other missionaries who had come from other parts of the world to start, to live the mission in certain countries. Sometimes those elderly missionaries are still present and they had required care. But what is emerging now very much is the care of older African sisters and how that care can be provided for. There are constraints very much at a community level because this priority of care of sisters often comes with a balance of trying to understand the priorities for limited resources with ongoing ministry needs, with ongoing needs for continuing vocations and formation as well. So often, and again, very much this is my experience in working with different countries and congregations, care is often provided for at a community level. Most of the time, they may lack the appropriate facilities for the care of members. But a lot of congregations now are trying to plan for the future of elder care and try and make changes and develop plans to really address this growing need of care of sisters within Africa. So what are some of the key considerations that you should take into account when you are planning for the care of your members? Very much the first thing that I would say to you is understand the reality within your congregation. And I say this very clearly, a lot of the work that I do when I am doing planning and strategic planning with congregations is the first thing I try to ask for is hard data, but information. So what is the reality of your members? And by that, I mean very much how many members do you have in each country? What is the age profile of those members? But the other thing I also ask is, what is the reality of the care of those members in each country? And very simply, it's, there's three categories. Are the sisters living independently? They require no care. Are they require some kind of, in English, we call it assisted living, but some assistance with their day-to-day life? Or are they in a full-time care situation? Whether that care is provided for in a community, in a private nursing facility, even in a hospital situation, but how is the care being provided for? But it's full-time care. But really, the first thing I would say is understand what is the reality of your membership now. That's an important factor because it's important to understand not only your reality now, but also then to try and understand what is the potential reality for those members and those sisters into the future. So if you have a large elderly population now in one country, that elderly population may not exist because through mortality in the next 10 to 15 years. So your needs will change over that time, and how can you plan for that? So it's one of the most critical factors, I would say, is understanding the reality of your membership. The other factors, even in terms of understanding your reality, is knowing about local care provision. So what is the reality in terms of the provision of care for the general population of wherever your sisters are based? Because culturally, it may be that care is normally provided at home. It may be that care is provided for in private nursing facilities, but the provision of care always varies depending on local realities, and it's important to understand that. A key consideration, and I have it twice in this slide, is understanding your financial capacity. So really understanding the resources that you have available to you from a financial perspective to care for your members, because care of members is obviously one of the most important factors of leadership, but financial resources are required for this, and you need to understand what financial resources you have available to you to determine how care is provided. Very much linked to this as well is the availability of skilled personnel. How you provide care for your sisters. Do you have sisters who can provide this care for you? Do you need additional lay people to help you in this task? What is available to you in terms of the reality of your congregation? Because again, that will help you determine planning for the future. The other thing that I would say in terms of that is very much the balance in congregations of you have a group of older sisters and maybe you have younger sisters. And if your mission is healthcare, is it still the appropriate for younger sisters to take care of older sisters? Is that the way that they should live the mission? Maybe if your mission is healthcare, that is true. But if, for example, your mission is very much related to education, again, is it appropriate that younger sisters are taking care of older sisters? It's just something to be aware of. If it's a planned decision, that's okay, but it just shouldn't be something that falls into place because younger sisters are available. The other consideration in terms of, planning for future healthcare is really, I would say, the availability of healthcare, but also elder care infrastructure. Either facilities that you have available already to yourselves, so communities that have already been adapted or could be adapted for aged care of sisters, but also looking at public or private facilities that may be available. Many times now I see in congregations, particularly you see it in Europe and North America, congregations who maybe establish their own smaller nursing homes, but due to increasing regulations, due to less need from their sisters, they're often divesting from those private nursing homes that they established and they're moving into public or private facilities. But is this something that you can consider from the outset in terms of planning for the aged care of your sisters? The other thing to consider, again, depending on your needs and depending on your requirements, is collaborations with other congregations. So again, if you are a smaller congregation and you have only a small need for aged care, is there a way in which you can collaborate with another congregation to provide that care so that the burden, the financial burden, the burden in terms of even personnel is not only on your congregation? So are there other ways in which you can work to consider the provision of this care? From a governance and decision-making perspective, firstly, I would say of course, it's important to incorporate elder care into your overall planning. So many congregations, while you might not have formal strategic plans for the future of the congregation, all of you have general chapters at different times, and all of you have provincial or local chapters, but there is a sense of planning for the future. And it's important to ensure that elder care and the care of members is always considered in terms of that future planning. And that in certain cases, you might have to come up with a specific plan just for elder care. I said it's important to have governance frameworks, but very much part of this from a leadership perspective is understanding if you establish your own healthcare facility, what governance is required for the management of that healthcare facility. It very much varies depending, again, on the local reality, local government regulations that they have, things like health and safety, we say this. I say this from the experience of a European context where maybe in the past, when religious sisters established care, nursing home facilities or an aged care facility for sisters, there was less kind of regulations in terms of health and safety, how sisters should be cared for. It was considered very much up to the sisters themselves how that care was provided. Now there is much kind of higher regulations. And in some cases, sisters had to close nursing homes because those regulations were not being met. So even if you are aware of, you don't have the same level of regulation now, I would say you always have to consider for regulations that may be imposed in the future and consider those as part of your planning. From a financial perspective, of course, any provision of care, any provision of support for sisters requires financial resources, but it also requires other resources, resources for community, resources in terms of property. So you need to consider the future cost, of course, of your elder care. If there are any supports available to you, and again, that is very dependent on your local reality. As I've already said, often in Europe, government provides support. It's the same within North America. But I'm very aware that within many countries in Africa, the government provides very minimal support to its elderly population. So there is less kind of financial support available from governments in certain countries. But the other thing to say is that you also need resources, and I've said here for formation, but very much that's about the formation in terms of trying to manage your elderly sisters. It is something that you may need to train younger sisters in terms of the governance of elder care facilities. You may need to train sisters in terms of healthcare, dementia care, planning for the future. So formation is really about the planning aspect and also the making sure the care of sisters is a priority, and sometimes there are resources required for that. The final, but not obviously the least important, it's just last on the list, is ensuring that when you're trying to consider about the future care of your sisters, it's about looking at the community life and spiritual support. I know very much, again, the kind of tradition in the past is, again, care be provided in a community setting. So even then, the establishment of private nursing homes only for religious, because there is that continuation of community life for religious in that setting. And of course, there's this continued spiritual engagement. Now, something wonderful that I heard recently from a sister was how there was a group of sisters, they were in Scotland actually, who lived in a smaller, and it was congregation-owned nursing home. But the number of sisters had become so small in this nursing home that it was no longer financially viable for the sisters to remain. So the sisters moved into a private nursing home with members of the general public. And one of the very positive outcomes of this was that one of the sisters said that in moving to this private private nursing home facility with members of the public. She felt like she had renewed her mission to the congregation and that she was now active in a new ministry. That this had been very spiritually engaging for her, that she could now interact with people in a different way, and that really it had given her and the members of her community kind of new life within this new setting. So I think there is the understanding that, of course, you can get this spiritual support, this sense of community, if religious sisters remain together in a private facility run by the congregation. But there's also the experience that you can get that in other facilities as well, and maybe it's just dependent on the reality of that care facility itself. So I'm going to try and take you quickly through some of these examples of different realities of the provision of care for sisters around the world. The first that I'm going to look at is a congregation I worked with who they are an international congregation that are declining in Europe, North America, and Latin America, but they have a growing number of sisters in Africa. And their two main kind of provinces in Africa were in Uganda, Kenya, and the Democratic Republic of Congo. In both of these provinces, they had small numbers of aging missionary sisters, but they had a growing need of their aged but also infirm sisters for the local African sisters. The congregation leadership, but also the provincial leadership within both of these provinces realized that there was a need to plan for elder care facilities in two countries, one in Uganda and another in the Democratic Republic of Congo. So the first thing that they considered was, well, what was the current need? And that was their aging missionary sisters and a very small number of African sisters who had additional needs. But the interesting thing that they considered was how could they provide this care and how could it be interwoven with mission? And decision was taken firstly in Uganda that the aged care community that they established was located at the same site as their formation house. And really what this meant was that any of the elderly or infirm sisters who were being taken care of in this community, they were side by side with the new younger sisters emerging and coming to the province. And it kind of allowed the sharing of wisdom, but also a sharing of different communities across this same location. Within the Democratic Republic of Congo, an aged care community was developed with a place of ministry beside it. So what they established was an aged care community, but at the same time, they built a hostel for one of their schools, which was very close. And in this sense, it meant that the hostel provided not only a source of ministry for some of the younger sisters in the province, but it also provided a source of income to support the aged care community. Because one of the challenges this province had was availability of financial resources to support their elderly sisters. But in developing the site like this, it meant that they had both a place of active ministry, so the elderly sisters felt like they were still involved, but also it provided a source of income for the provision of aged care. Many of the discussions that we had with the sisters as well and the development of both of these facilities was to have an appropriate size, but also appropriate standards for both communities. I very clearly remember initial discussions in Uganda that the sisters wanted to build a facility that had 20 bedrooms and was kind of a very grand, kind of very large facility. But when we looked at the reality of their membership presently, but also into the future over the next 10, 15 years, we realized that there was never going to be a need for a 20-bed aged care facility, even if they achieved the number of vocations that we were expecting. So we reduced the size of the facility that was built. They also were trying to build a facility that was almost on a par with not quite hospital standards, but very, very high standards, which was very much out of line with the local reality of the people who were around them. And even the sisters themselves said that they felt like it was not appropriate for them to build something, a community, where the standards were so different to what was the reality of local people. So again, there was a kind of revision of how the care facility was built, so that while it did cater for the needs of the sisters, it was more in line with the local realities of where the actual community was based. The other thing that had to be considered for these projects was, firstly, the availability of property, the land that they were used for development. This congregation was lucky in that they had land available. So in Uganda, it was built on a site where they already had a formation house and land was available. In Congo, they also had land adjacent to a school that could be used for this. But again, many congregations, when they're trying to consider this future plan for aged care, availability of land, availability of properties can be a key consideration. A very important factor in this was the financial resources. These were two new facilities that were built, and both were actually funded by the international congregation. But the ongoing running costs had to be the responsibility of the local provinces. So again, they considered this as part of their planning, and it was very much factored in when even they considered the size of the facility and what care would be provided and how that was provided. They also had to consider the provision of appropriate staff, and if those staff, if it should be sisters who were providing care or if it was lay people. And in both cases, they used a combination of both. There were sisters who provided care, but there were also lay people who were appointed as well. The second case study that I'm going to share with you today is based on a congregation I worked with they were a very small international congregation who had very much a reducing number of sisters concentrated within Europe. And again, this is kind of the opposite end of the spectrum to the African sisters, but I think what this does is shows you the reality of how care was provided in the past and if it's appropriate for the future. So in this case, care was provided, and this is the building, the actual building on the right-hand side you'll see here. Care was provided in a very historical property to the congregation, but it was a very rural property. It was isolated, was not connected well to services. And while it had been adapted, this property for elderly needs, the cost of care was significant because this was an unregistered facility. There was limited government support. And the reality of this province for this congregation was that the cost of care was so significant that it was significantly reducing the financial resources available to them. It was very difficult working on this project for the leadership team because they, of course, knew that the primary focus had to be on the needs of sisters. And the question they had to ask themselves was, is this the best location for the provision of care? And can this care be provided somewhere else? The sisters were elderly, and they had to consider the impact on asking these sisters to move from somewhere where not only they were very comfortable, but they were also very spiritually connected to this place. But really, the question was the provision of care, was it the best place for this, considering the age of the building and also the cost of this care as well? A very critical part that ended up helping the leadership team make the decision was the availability of financial resources. They simply did not have enough money to be able to provide care in this way for sisters into the future. Because they got very limited government support, because it was an unregistered facility, the cost of care was extremely high, and it just was not sustainable for the future for the care to be provided in this way. But it was very, very challenging for them because moving sisters out of this facility, really, that also meant that the congregation had to let go of part of their heritage. It meant that they were moving away from something that had been deeply rooted to their mission, and that they had to move to somewhere where it was less connected to their history, and it was very challenging for them. The other significant challenge that they had is that given, I mean, it's a beautiful property, but it was a protected, we call it a listed building in English, but it was protected. There was limited future use of this property. And really, even in terms of moving the sisters out of this property, there was limited financial income that the sisters would realize even from the sale. So again, it had an impact, but I think the main thing that we could really, you as I think could learn from this example is the provision of care sometimes that you adapt a community to kind of meet the needs of sisters when maybe that actual building itself isn't appropriate. Or really kind of understanding the point at which a building can it continue to be used for elder care into the future? Are you holding on to it because it is a heritage property? Or are you holding on to it because really it's the best place to provide the care for sisters? I think sometimes that's a question that needs to be asked. The third example that I will just go over is another European congregation where this was a congregation, again, they were international, but they had a significant number of sisters within Germany, with significant continuing needs for care, but with the knowledge that they would only need this care for the next 10 to 15 years. And really, the desire of this congregation was not only to develop an aged care facility that would support the needs of their sisters, but also to provide a facility that would also meet the needs of a local population. And what this congregation undertook was they partnered with, in this case, a local government, but it can also be done with a private organization. And they developed an integrated aged care facility for sisters, as well as providing care for local residents. So for them, it really extended their charism of compassionate care, but also it meant that they knew that since 15 years into the future, that this would be a continued legacy for the congregation as well. So in terms of this scenario, what the province provided was they provided land, they provided a certain investment in the facility, but they also were guaranteed a long-term income which would support continuing needs of the mission. So even though they invested some of their resources now, they knew that there would be a long-term income received from the provision of this facility that would not be used within Germany, but would be used within the international congregation for mission in other places. A significant part of this was to ensure appropriate governance for this structure because there was a specific legal entity that had to be established for this facility. There had to be a specific agreement between the local government and the congregation, not only about the provision of land, but also the provision of services and also the future income. The facility was not managed by the sisters. It was managed by the local government. So again, an agreement and governance structure was put in place to show that the local government would be responsible for not only the management of the facilities, but the resources for the provision of that care. And really, the kind of main focus of this was that this plan that this province had, it considered not only the short-term needs of sisters, but also it considered longer-term mission and the needs of the congregation as well. So it's just an example of how you can establish, if you go into partnership with others, maybe a facility that meets not only short-term needs, but may provide future income and support the mission in other places around the world. My final example is a a congregation within the Philippines who again approached aged care in a different way. So this was a congregation of sisters in the Philippines, and for them, they had the balance of, they had both younger sisters in ministry and a smaller number of elderly sisters who required care. And what they did was not only providing aged care for sisters, but really they developed a ministry so that they could provide this residential aged care for sisters, but also they could support the elderly within their local community. So they created this intergenerational inclusive care facility. So it's a facility, yes, that provides care for sisters, but also an active ministry for the congregation in which younger sisters can be involved and also kind of provide a level of income to the province as well. There was investment in this facility by the province, but ultimately, an important factor of this is that this ended up being a ministry that was financially self-sufficient. They did have some partnerships with local donors, with diocesan networks, which helped kind of sustain the provision of services. But it was important for the congregation and for this province that this was not something that the province had to financially contribute to, even though it was providing for the aged care of sisters. The income that was generated from the provision of care of those in the local community helped provide the financial means to support the elderly sisters within that congregation as well. And really, I've seen this in other congregations within the Philippines as well, where Catholic congregations really are extending their elder care services beyond their own membership to try and address kind of, as I've said here, broader social needs while also maintaining this strong kind of spiritual dimension. So if I just finish up with just some specific recommendations that I could give to you if you're trying to consider planning for elder care. The first, as I would say, is yes, assess and understand your local reality, your current reality. What is the reality of your members? I call this demographics. What are the realities of the healthcare infrastructures already available to you, either within your congregation or from governments or from private providers? How is care provided for in a local context? But also, what is the financial capacity that you have to provide care within your congregation as well? If it's appropriate, either at a congregation level or a provincial level, develop a strategic elder care plan that integrates not only this reality of your demographics and local care provision, but considers pastoral elements of care, that considers the community perspective, that considers your financial reality. You don't have to have a separate strategic elder care plan. You could also integrate care into an overall strategic plan as well. There is one of the possibilities if you are considering a future provision of care and a new kind of way of working. Is it possible for you to explore a collaborative model? So some of the examples I've given you today, a partnership with a public provider, an inter-congregational initiative, a local network. How are others providing care, and is that something that you can collaborate with others on? Invest in formation and leadership development for elder care. This not only includes gerontology, the actual physical care and mental care of sisters, mental well-being, but also, as I've outlined today, the governance realities. So the realities of if you're establishing a collaborative model, to make sure you have the appropriate governance structures in place for that, but to have sisters trained in that as well. If you are going into a different kind of model, ensure that any facility that you establish or any partnership that you go into, that you have appropriate legal and governance frameworks. And also, I would say that you ensure that you meet whatever the local regulations are and plan for changing those regulations in the future. And finally, to maintain the spiritual engagement of your elderly members, as mentors, but also that they actively contribute to community life. So whether that is they're in a community setting or even if they're in another type of nursing facility, that those elderly sisters, often they are wonderful contributors and continue to be wonderful contributors to community life. So in summary, yes, religious life is experiencing significant demographic shifts. There are aging populations and declining vocations in many regions. But really, as I've said to you today, really the global trends very much vary. There is certain growth in Africa and parts of Asia, and in those places, increasing need for elder care. And yes, there is a decline in Europe and North America, but again, elder care continues to be a significant need in both of those areas, even if it's in decline. Elder care needs really, they're urgent. Often I see, sometimes I work directly with provincial leadership teams, and I see the time that it takes in terms of taking care of elderly members. If there's someone who has to move into a nursing home, if there's someone who needs care, that can be very time consuming for those, especially those who are in local leadership. But really, there is a need to have a plan in place to ensure that whatever care is being provided, that it's culturally sensitive, but also that it's sustainable for the long term as well. That is not just something where a congregation, local leadership is reacting, but that there's always a plan in place for the needs of sisters into the future. Congregations face very significant financial and governance challenges in terms of planning for long-term well-being of sisters. The financial cost of providing elder care is significant. And again, there is a need for congregations to ensure that they not only have resources available now for the care of sisters, but to plan for those financial resources and the requirements of financial resources into the future. Hopefully, I've been able to show you today these different case studies, some diverse approaches and ways of how you can provide care, partnerships with governments, moving away from the provision of care in heritage properties, trying to have inclusive care models, but really seeing that it very much depends on the local reality and the needs of your sisters. But ultimately, this planning with foresight, it ensures the dignity of your sisters, it ensures the continuity of your mission, and also it responds to this need for responsible stewardship of the resources that are available to you. So yes, we do have some time for questions. I've put my email address up here if anyone has questions afterwards, but I do also know that we will have time for questions today, and that if your question is not answered today, that there will also be an opportunity to ask questions at a later date. So thank you all.
Thank you very much, Helen. Thank you for all of this information. We're going to take 5 or 10 minutes here for those who can stay on for any questions. So if you have a question, at the bottom of your ribbon, you will see a raise hand thing. I'm going to click it just so you see. It shows your hand raised. So the first one I see is Sister Rogers. Go ahead, please.
Good morning, good afternoon. Well, my question is, looking at all of the PowerPoint slides, beautiful presentation. Thank you, thank you, thank you. How do we help the congregations with that financial need? How do we get them tested and get those results so we can begin to, get them placed?
Mm-hmm.
So testing and helping financially getting them placed.
So if I understand your question from an overall perspective, are you asking about trying to plan for the future financial needs of the elder care of sisters? Is that what you're asking me? Yeah, okay. I mean, very much I would say in relation to that is that in the same way that I said, understand the reality of your demographics, I would say link that very much to the reality of your finances. So many of the congregations that I work with already, they already have made a plan. Sometimes it's called a pension plan. I don't personally like that word, but they've planned for the future elder care of their members. But many congregations have not done that either, particularly if they are a congregation with younger sisters. But I would say, in a very similar way to a person who is in their young 20s and is starting work has to plan for their future pension, the same should be said for religious sisters. You need to consider from a very kind of early point of a sister's life how to plan for their elder care and how to make sure that you have the appropriate resources kind of invested for the future elder care of sisters. So I would say first understand the reality and then try and understand what your future needs might be in relation to elder care. In terms of, I think the second part of your question was about placing sisters. Was that correct?
It was the testing, like getting them tested, so then we know
Yeah.
exactly where you are on the spectrum, and then making sure that they have that money coming in or saving,
Okay.
and then the placement. Like you showed a facility, but like all around the world, they could be all different things, you know.
Sure.
Right. How do you know, how do you
the needs
begin
of
to know,
sisters.
Helen, what the future of the
Yeah.
epidemiology in a
Sure.
way is going to be of those sisters?
Yeah. I have to say, I'm going to admit, I mean, I'm not an epidemiologist. I'm a statistician at heart, but what I would say is, I mean, the first step again is to understand, well, what's your current needs? Because sometimes looking at current reality in different countries and different communities can be an indicator of what might happen in the future. But the second thing I would say is that, I mean, in terms of getting sisters tested or understanding the epidemiology when sisters may need care, employ professionals who can help you with that. Very much I see in many congregations, particularly ones with elder communities, they have either healthcare coordinators or they have specific medical staff who assist them in that. And what I would say is find the right personnel to assist you in that. Sometimes you may have sisters available for that role, but if not, find an appropriate layperson who can help you with that.
Right. So do I see Sister Rogers, would you lower your hand so we can, let me just screen through here and see whether I see any other hands. Oops, I think I just did. No, I missed that. One of the things that I would like to say from the Anna Trust is that to recognize that we will be, and if you watch the newsletter in December, you will get the notice. We will be issuing a request for proposals for planning grants of collaborations of congregations, so that if you are in a place where you have 2 or 3 congregations who all are facing this problem, and for instance, what you really need is financial analysis help. Helen talks about some of these dimensions of planning, and many times congregations or groups of congregations don't have a financial analyst, in their congregation. They have many teachers and many nurses, but no financial analysts. The Anna Trust is here to help you identify the resources you need for those plans, and then to provide you with a planning grant so that you can begin to address these problems. You need some analysis of your entire congregation. You're not even sure what the age structure of the congregation is globally.
Yeah.
So just be aware that in December in the newsletter, there will be a link to we're going to have a digital platform for the beginnings of the Anna Trust's own grant making for planning for elder care. So keep your eye on that. That means you have to read the newsletter. So if you don't see Miriam, do you see any other hands? What I'm going to say is that this session will be on the YouTube channel in a few days. So we'll send the registrants the link to that. So if you want to spread that around or go over this again, that would be great. We have a Google form for evaluation, and as you can see, we listen to you. So please fill out the Google form. There's a question in the chat, I'm just told. Miriam, can you help me with that? Where's the question in the chat?
There are so many questions, but people can write to our email, info@dianatrust. I'm going to send to in the chat all the emails, so we will back to you as soon as possible with all our responses.
We're going to move those questions to Helen, and she has agreed to look through all of the questions in the chat, group them, and then get back with some answers so that we can get you your answers as well. But there is going to be an evaluation Google form for the webinar. We'd appreciate your filling it out. We do listen. We want to get better. We want to do this better, and that will be in the chat as well. And I just remind you that the last webinar of 2025 will be on December 15. Again, on dementia. Is dementia preventable? And we will welcome back Sister Peter Lillian from the Avila Institute, who will return to the question of dementia and its recognition and the many things that can be done at younger ages for prevention. It's wonderful to serve the elderly, but we have to do something about it when we're 40 if we expect to have some effect when we're 80. So the prevention will really focus on what we can do with the younger sisters to ensure that we reduce the dementia burden of our sisters when they are older. So thank you very much, everyone, for joining us. It's been lovely to see you all, and we look forward to seeing you again at our next webinar. Thank you very much.
Thank you. Thank you all.